Folks, Nick the Nurse here. Today we're going to be talking about some of the nursing diagnoses that you as an astute nursing student should think about when formulating a care plan for a patient who has valvular heart disease. One of the big things that you might see in a patient who has valvular heart disease would be a nursing diagnosis of decreased cardiac output. Why? Well, if the valves in the heart aren't working, the heart isn't able to conduct itself appropriately by pumping what it needs to pump out. As a result, you're going to have decreased cardiac output. You, as the astute nursing student, need to make sure that you address this in your care plans and be prepared to address it if it comes up on the NCLEX. And you can do that by providing some of the assessment tools under signs and symptoms, as well as some of the nursing interventions that are located in some of the other videos on valvular heart disease. Activity intolerance, that kind of goes hand in hand with cardiac output, or decreased cardiac output, that is. Because when you have decreased cardiac output, you are going to have activity intolerance because you're going to be exhausted. You're going to be tired. If your heart isn't pumping, you're not going to get that energy. You know, I recently started working out again. I've got some pounds to lose, and I know that when I go to the gym or I go out even for a walk or walk up a couple flights of stairs, I feel pumped. And where that word pumped comes from is when your heart is pumping. It gives you energy. So when your heart isn't pumping effectively because it can't get enough heart or enough blood, or maybe even too much blood, or you have regurgitation with the valves, your heart isn't pumping effectively. And as a result, you're going to be fatigued. As an astute nursing student, you need to be able to address that in a patient's care plan, or if it comes up on a nursing school exam, or even on the NCLEX. So keep that in mind. Ineffective tissue perfusion, well, if you don't have oxygenated blood getting where it needs to go, that kind of goes without saying. And anxiety. A patient who has valvular heart disease, there's a lot of fear of the unknown. So you as a nursing student need to make sure that if it comes up in nursing school exams or on the NCLEX, that you address patient teaching. Put the patient at ease. Knowledge is power, and you want to empower your patients. Don't let them get anxious. Give them knowledge, give them power. That'll help them kind of relax. So I want to thank you for watching my video today. If you'd like to check out any of my other free, completely no obligation videos, you don't have to buy anything, check them out. www.nickthenurse.com. Again, that's www.nickthenurse.com. Thank you for watching, and I'll see you next time.